Good morning, everybody. Thank you for joining us. We're going to kick off our discussion. This is part of a series of teleconferences that we've had to inform the public and to help them protect themselves and to get access to resources during this very, very difficult time that we're all going through. My staff and I have been working to prepare our constituents, reaching out to our constituents, keeping them informed and helping them to answer questions and working them through application processes and doing everything that we can to be responsive to people that are desperately in need. And the situations that we have experienced with our constituents are very dire. They're very trying. People many families are suffering very, very much right now. So we've been doing everything that we can to be responsive, and we want to encourage people to continue to call us so we can do everything that we can to help them. Today, we have prepared a special discussion around our seniors. Our senior population, currently under what we've heard, are currently the most vulnerable people under this pandemic crisis. They have suffered in so many ways through this problem, and including people that have gone out this time. While there are so many people out there helping people through this crisis, there are others taking advantage of the situation to profit off of people, oftentimes the most vulnerable. We have a Spanish interpreter available for anyone who needs such accommodations. Para unirse a la teleconferencia y escuchar por teléfono en español, por favor, llamar a la siguiente línea. La teleconferencia en español será únicamente accesible por teléfono. El número sin costo alguno es 877-692-8953. 877-692-8953. El código de acceso para acceder a esta llamada en español es 373-7869. Otra vez, si tienen algo con el cual escribir, el teléfono es 877-692-8953. Y el código de acceso es 3737869. Lo repito otra vez, 3737869. Thank you. We're very fortunate to have some very esteemed speakers with us virtually, beginning with Rosalina Blankenship. She's the public administrator at Imperial County Agency on Aging. We also have Carlos Morales. He's the Senior Adult Protective Services Specialist with the San Diego County Aging and Independent Services Department. And we have Scott Parelle. He is the Deputy District Attorney and Head of Elder Abuse Protections Unit at the San Diego District Attorney's Office. We also have Bob Prath, the Executive Council Member at AARP California. We have Marta Rañón, the Executive Vice President for Southern Caregiver Resources Center. Some additional housekeeping before we get started. I wanted to remind folks listening to please reach out to my offices for more information if you need any help with any of the state agencies or anyone at all for that matter. Please use us as a resource. For those here in San Diego County, the number is 619-409-7690. For those in Imperial County, it's 760-335-3442. And our capital office is 916-651-4040. Again, if you have a pencil and paper ready, 619-409-7690 in San Diego County. In Imperial County, it's 760-335-3442. And for the capital office, 916-651-4040. You can also visit my website at hyperlink www.scn.ca.gov/HUESO. We're going to begin with our speakers because you've tuned in to hear from them. They're the experts on our panel, and we're going to give each will give us an update on each of one of their agencies and the services they provide, so that you know who to go to in case you need help. We'll start with Rosalina Blankenship. She's a public administrator from Imperial County Area Agency on Aging. Rosalina, welcome, and thank you for joining us. And I expect that the weather out there in Imperial's at least over 100 today, isn't it?
Indeed it is.
It is.
Good morning, Senator Hueso, and thank you for giving us the opportunity to join you this morning and be able to speak to your constituents. Hello from Imperial County, and yes, we have a heat warning today and tomorrow, reaching highs in the 105s. So obviously that's of great concern to our desert community, specifically to older adults that we are serving in our community. As the heat rises, there's the concern for those older adults that may not have sufficient funds to pay the electricity bill, pay for their food and their medications. And so we're very alert and aware of things that need to go on in order to assist them during this time. We have already purchased a fan for an elderly woman because she didn't have an air conditioner. And so things like that really are of great concern. And during this time, it's been very heavy for the Area Agency on Aging in Imperial County, as it is statewide for many of the AAAs. Currently, the Imperial County Area Agency on Aging is providing a senior nutrition program. Many of you know that the congregate meals have transitioned to a home delivered meal program. We are currently serving close to 600 seniors in our community with meals 7 days a week by our service contractor, Catholic Charities. Under the COVID-19 emergency funding that we received through the Families First Corona Response Act, we were able to hire 2 local restaurants, Brownie's Diner, who is providing senior meals in the city of Brawley, and then Rosa's Plain Food Restaurant in the city of Calexico. So that has been keeping us very busy, just trying to get protocol established, all the logistics involved in serving meals to our senior community. In addition to that, we found very quickly after the governor's stay-at-home order that there were many needs for older adults in the community. And I mean, we laugh about it, but toilet paper was one of the biggest issues. And so fortunately, we were able to get donations from locals such as the Imperial Valley Masonic Lodge, the Imperial Valley Family Medical Care Group, who donated large sums to our agency in order to provide toilet paper, tissue, water, toiletries to older adults in our community. We have serviced close to 1,200 seniors with those items. Today, we started our second phase of our wellness check to many of these seniors. We are currently working with the EOC division in order to order a mass communication system so that we can start some of the robocalls to all of the older adults in Imperial County to ensure that services are available to them. We've been working very closely with the Imperial Valley Food Bank, who has graciously donated hundreds of food boxes that we have been able to deliver to older adults in our community. In addition to that, we quickly set up a grocery shopping list that's available on our website, along with a pharmaceutical list of those that are delivering in our community. Our website is www.aaa24.org. Those services and other services available to older adults in our community are noted on our website. Right now, legal assistance is huge. And so We want to make sure that our constituents know that elder law and advocacy is ready and able to assist with any eviction notices. I mean, we know that all of it has been postponed, but seniors are still concerned. They don't know what to do, who to turn to. So we want to make sure that they're aware that they can call our agency at 760-337 442-265-7030. Let me repeat that number once again, 442-265-7030. So many things are underway. We are currently doing grocery shopping as well for older adults. If things need to be picked up in the community, we encourage older adults to contact our agency so that we can assist them in this area. We're also providing microwaves to those that are in dire need of one. We are strongly encouraging families and neighbors to help their loved ones. We are very active with the governor's Stay Home, Check In, Save Lives campaign, promoting that to ensure. And then recently we released information to our older adult community about the Friendship Line that was initiated by the California Department of Aging, encouraging seniors to contact that line, which is 1-800-971-0016. Again, that number is 1-800-971-0016. And that line is set up to help older adults that are feeling isolated, suffering from loneliness, depression. There are professionals on hand ready to assist. In addition to that, we have our local behavioral health department that is available to answer any calls. Their access line number is 442-265-1525. And again, our phone number at the AAA is 442-265-7030. We want to ensure our community that those that have loved ones in long-term care facilities, we have our on-call long-term care ombudsman, Carla Flores, who is available to connect families and friends to their loved ones in these facilities through Zoom calling. They can contact Carla Flores, our local long-term care ombudsman, at 442-265-7032. So many services underway. Transportation, curb to curb transportation is available through IVT Ride locally, as well as IVT Access. So we thank the Imperial County Transportation Commission, who has been very engaged with our department in helping us provide delivery of senior meals in our community, as well as all the departments that have come together during this time to help us with many of the services being provided, such as probation, behavioral health, public works through their park rangers. We have individuals from facilities coming in, helping us with the assembly line, getting emergency relief bags out. So there's a number of things going on, but everybody's working together, getting things done to make sure that we're serving you, our community, and know that you can contact us again at any time at 442-265-70 to help meet the needs of our older adult population. Thank you. Imperial County, aging strong.
Thank you. And we also have our staff in Imperial County. We have John, Alondra, and Mario out there standing ready to assist anybody if they need any help. So we encourage them to call our office as well. Thank you very much for that information. Now we'll go to Carlos Morales. He's the Senior Adult Protective Services Specialist in San Diego County's Aging and Independent Services Department.
Hello, everybody, and thank you again, Senator Hueso, for inviting us to be part of this panel. And muy buenos días a todos. Espero que haya gente de habla hispana allá afuera que pueda recibir estos servicios también. So my name is Carlos Morales. As you mentioned, I currently am working with Adult Protective Services with the County of San Diego. And my current role is that to provide support to Adult Protective Services investigators who are out in the community responding to allegations of abuse and neglect of our older and dependent adults. But right now I'm going to talk more about the agency I'm representing, which is Aging and Independent Services with the County of San Diego. Basically, we're the agency that provides services to older and dependent and disabled adults throughout San Diego County. And we've, of course, had to adapt in response to the COVID-19 situation. And all our services continue to be available. And I'm going to go ahead and describe those in just a minute, but I want to start by pitching our website. If for those of you who have access online, please you can access all the services for Aging and Independent Services through aging.sandiegocounty.gov, www.aging.sandiegocounty.gov. Or what I did just now is I just went on a search and put aging services or older adult services, and AIS popped up right away. If you don't have access to the website or aren't online, you can also call us at 1-800-339-4661. Once again, 1-800-339-4661. Our call center is currently up and running as usual, and we are able to take calls throughout the day in 24 hours. If you do contact the call center, you will get a lot of information from them. They do an amazing job in accessing services for older adults and their caregivers and dependent adults as well. The call center can take in a referral for in-home support services if there's a need for home care, and they can make that referral, take down the referral and send it on its way and get in-home support services to come out and do an evaluation. They can also access our care management programs for older adults, dependent adults. What does that mean? It means that if you are in need of case management, they can take down that information and send you on. They can also take reports of older and dependent adult abuse and neglect and send those on to Adult Protective Services so that a response can take place in a very timely manner, especially if the situation is, if abuse is occurring, as could be, due to scams or other kind of financial abuse situations that are happening as we speak as a result of this. They can also access services through that number. You can also access services for people who are staying at home, of course, and might not have the resources for food or prescription medication or in need of emotional support. So Aging and Independent Services is basically the go-to agency for older and dependent adults in San Diego. As I mentioned before, we have had to adapt our services and the way we provide services to meet the needs during this special COVID-19 situation. We are constantly updating our website, and we also have access to all kinds of different food services that for food delivery at home. We are working with community partners like they are in Imperial County, so that home delivered meals are provided in a very timely fashion, and they're done throughout the whole of San Diego County. Also, if there's a need for transportation, you can access the transportation lines, and we have a special COVID 19 edition that can bring you all that information on the transportation options that are available for you. Then, for example, if you're feeling stuck at home and in need of moving or of doing a little exercise or seeking this more feeling fit, you can actually access that kind of resource through our Feeling Fit Club exercise program. That's available on TV twice a day, and you can also access it through YouTube. So Aging and Independent Services on top of that as well. There's commercial food delivery services now, such as DoorDash and Amazon Fresh, that can assist you, and that information can also be accessed through our website. So another wonderful resource, of course, is 211. If you dial 211, you can also get a lot of information and referrals from them. Our elder law and advocacy group is up and busy. So if there's any need for housing issues or benefits issues, you can certainly call us, and we can provide you with a referral to them as well. So we're busy. It's a different world out there, and so we've had to adapt our services to ensure the safety of our and the well-being of our older adults out here. So I'm open. We're open to taking any questions or receiving your calls once again through our 1-800 number or by accessing our website. Thank you.
Yes, thank you. And after all the presentations, we have a list of questions that have been provided by many of our constituents, and we'll have a chance to offer those up to whoever can answer them. We'll move on to Scott Parelle, the Deputy District Attorney and Head of Elder Abuse Prosecutions Unit at the San Diego District Attorney's Office. Mr. Parelle, thank you for joining us. Thanks for being here. Actually, he's not on the call yet.
Here I am. Yes.
Where are
Hello.
you? Oh, there. Okay.
I'm here. Thank you so much, Senator Hueso, for having me. Yes, I'm a Deputy District Attorney. I'm the head of our Elder Abuse Prosecution Unit. Of course, the District Attorney, Summer Stephan, we're all fortunate to have her as our leader of the office, and her dedication to elder abuse is one of the mantles of her, all of the initiatives that she's working on. So we do have some concerns during these unprecedented times. Of course, the number one risk factor for all the kinds of elder abuse is isolation. That's under normal conditions. And so when we have this new normal that we're all adapting to, where doctor's appointments are being canceled and there's less access to services, nourishment, medication, people are isolated in environments in their own homes sometimes that is not safe, then we've obviously have increased risk factors. And so this is really a call to arms for everyone in the community to be extra vigilant. And the best thing that you can do during these times is, if you just suspect elder abuse, financial abuse, physical abuse, neglect, call Adult Protective Services. You don't need to witness a crime taking place. And we're not talking about calling 911. We're talking about you being concerned about a neighbor or a friend or a relative. Pick up the phone and call Adult Protective Services. We could have that number available later, but if you do have a pen out, that number is 1-800-339-4661. You could be anonymous, and you could just call if you suspect elder abuse. So I want to talk just in the few minutes I have about some specific concerns that we have specific to the COVID-19 virus. One point I want to make is in regards to physical abuse. Now, the most common form of physical elder abuse that occurs in our county is by a family member. Over 60% of our cases involve a family member. And so if you do know an elder that might be isolated in their home with a child or a grandchild who is in a risky group, such as someone who has mental health concerns or issues with drugs or alcohol, you want to be extra vigilant and make those Adult Protective Service referrals. When it comes to financial elder abuse, unfortunately, we know there are scammers out there, and they're trying to get our money all the time. This is no exception, and in fact, they will use any opportunity they have to try to use it to their advantage and get your money. And so we have alerts out both locally and nationally. People, these are the most common scams that they're using the COVID-19 virus to help, right? The one is related to the stimulus checks that the government is sending out. So you might get a phone call from someone saying they're from the IRS or from the Social Security Administration, and they'll ask you for your personal information and say they need that information in order to send you the government stimulus checks. The IRS and the Social Security Administration will never call you. If you get a phone call like that, hang up the phone. They will not call you, and you do not need to provide any extra information in order to receive your stimulus checks. The other calls that we have seen a spike in are false offers for COVID-19 vaccinations, cures, test kits. If you get a call or an email or something pops up on your computer that is offering you a cure or a vaccination to this virus, do not believe it and please disregard it. The other one that we're seeing is fake online sellers that are saying they are the only ones that have masks or personal protective equipment or cleaning supplies in stock. And we've even seen the depraved kinds of calls where people will pose as fake charities, saying that they're trying to collect money for our frontline workers. These are all scams, and you must be aware. So what can you do to protect yourself? It's the same as all the time, whether or not there's a virus. The best advice that we can give you is, if you do not know the phone number that's calling you on your cell phone, do not pick up the phone. There are predators lurking, unfortunately, and the best way to protect yourself is to just not pick up the phone. If you do pick up the phone, the moment that someone is telling you that there is some emergency, whether it's a government call or maybe someone even pretending to be your grandchild that has become sick with this virus, if someone demands money, you know it's a scam. Hang up the phone. And finally, if you are ever asked to make a payment for anything using a gift card, Bitcoin or cryptocurrency, or if someone tells you to go to the UPS or FedEx store or the post office and send them cash through the mail, I can guarantee you from the district attorney's office, this is 100% a scam. You must eliminate and terminate the contact with the person that is asking you to do those things immediately. These are just some ways that you could keep yourselves and, more importantly, the elders in your life safe during these unprecedented times. Thank you so much, Senator Hueso, for bringing us all together in this forum. It's my pleasure. And on behalf of Summer Stefan, it's our honor to be a part of it. Thank you.
And thank you, Scott. And I want to apologize. I think we're having some technical difficulties. Initially, when I introduced you, you disappeared from my screen, and you were kind of breaking up a little bit through the message. So, but I think we got the gist of the message. I want to apologize for the technology often fails. So I'm sorry about that. We're going to move on to Bob Pratt. He is the Executive Council Member at AARP, California. Bob, thank you for joining us. What a beautiful background. What's that mountain range?
Yeah, great. That's Borrego, and I put that on so that when my wife walks behind me in her bathrobe, she said, "You got to put something up." And so, good morning to all, and thank you so much for having AARP California on, and also thank you for these information centers. I know to reach out and provide valuable information to each in our region. Most of our pandemic-focused AARP resources are filed by topic on a web page that can be reached by simply Googling AARP coronavirus. That's AARP coronavirus or AARP coronavirus Espanol. That second website will get you to an equivalent huge list of resources in Spanish. And so if you Google those simply AARP coronavirus or AARP coronavirus Espanol, you'll see links which will get you to this omnibus web page. The list of resources on that page you'll see include navigating the pandemic job market, AARP connections, joining or forming a neighborhood mutual aid group. We have hundreds and hundreds of those throughout the country. You can volunteer to provide or register to receive friendly calls. We have about 300 trained volunteers, about 50 in California, that are trained to just do friendly calling to give reassurance and provide company to folks. There's a What's Up with Care Facilities section that has lots of caregiver answers, including 6 questions that loved ones should ask their nursing homes. There's a section on stimulus law payments and how to prepare for a telehealth appointment, current scams, frauds, and much, much more. Many without a smartphone, however, we found could not access these resources. So in partnership with Governor Newsom and the California Department of Aging, AARP published the California for All Resources card, which is a kind of a one-stop information guide on COVID-19 for all Californians, but especially for older adults, as part of the Stay Home Save Lives check-in campaign. This card is a simple 5-way card. I noticed that it was great, Ariel, for you. It's on your website. It's been mailed to millions of Californians by AARP and the California Department of Aging. It provides trustworthy guidance on where to get the most up-to-date information on COVID-19, where to find community resources, how to avoid scams and fraud, as well as how to stay safe at home and get caregiving support. It gets you to the local resource quickly, many of which we have on the call. Residents and organizations can request an electronic copy of the card. It's offered in English, Spanish, and Chinese by emailing California AARP at aarp.org. I'll put that in the chat line so that folks can see it if they want to, so they can email and get copies of the cards that they can mail out themselves. We also have a national call-in line for our 38 million members, and anybody really. So what appears to be the top 3 topics for us are fraud, as Scott went through. It used to be coronavirus, a little bit about utilities, it used to be, actually the census. The calls were latched onto the census. Now, of course, they're latched onto stimulus checks. And in fact, what I just said should raise alarm, because in any official document you'll ever see, the official term is economic impact payment. They will never use the term stimulus check or stimulus payment in any way. And so Scott gave some good hints. And first of all, not answering anything that has a stimulus, a check reference, and not even picking up the phone, because he was right. If you pick up the phone, you immediately, whether you listen or not, you go on somebody's sucker list as somebody that picks up their phone. So it's best not to even answer calls, as Scott said, on your phone that you don't recognize. Other issues we hear about are caregiving support. How do I protect people that I care for while observing social distancing? This is a challenge. Knowing that you're not alone and getting good advice is really key, and there's a lot of information on the website that helps you do this. It's just a friendly website that has some reassuring words. Specifically, however, we're working on a pilot program with 211 LA and USC's Family Caregiver Support Center to offer support through a community program called Ayudando a Quien Ayuda, Helping the Helper. It's designed for caregivers seeking guidance and resources to help care for a family member or a close friend, and we hope to expand that. Finally, I guess a few words about the AARP age-friendly cities, which I work with. There's 50 cities throughout the state. In the Southland, those jurisdictions are Chula Vista, San Diego County, San Diego City, and National City. They have or are all in the process of listening to their citizens and organizations to identify needs and resources. And in doing so, many had already taken community livability actions pre-COVID, which served them well to address some of the urgent needs that have risen in transportation, food poverty, delivery. And so they were ahead of the game, and this age-friendly program got them there. So in this COVID era, so our hats are off to them. So thank you all. And I think I'll have a little more to contribute when we get to the questions. So thank you, Senator.
Thank you. Now we'll go to Marta Rañón. She's the Executive Vice President for the Southern Caregiver Resource Center. Welcome, Marta.
Thank you so much, Senator Hueso, for allowing us the opportunity to talk to all of your listeners and your constituents about all the services that we have. We are a nonprofit organization that focuses 100% on the family caregiver. And a family caregiver is anyone who is caring for the well-being of someone else who needs assistance with activities of daily living, like let's say bathing, and maybe they're elderly and frail and they're over 60, or someone who has a cognitive impairment like memory loss or dementia or Alzheimer's disease. We are here to focus on you 100%. And some of the services that we provide are, if I may, I have a screen that I want to share with you. And I don't know if you can see this. Is that visible? Can everybody see that?
Yeah.
Yes. Okay. So we have a myriad of services that we've had for a while now, but given the COVID situation, we've transferred a lot of our services to an online platform. That is, our support groups were still meeting, but we are doing them now via a platform like this, like Zoom. And we have our professional staff who are there available to intervene in case someone needs further assistance. We are in the process of transitioning our counseling program, which is usually 6 free sessions related to anything on caregiving and some of the challenges that caregiving brings. And right now we're transferring to an online type of a counseling program. We have legal and financial partners who can assess caregivers on any issue related to caregiving. And what is great about this is that we pay for that initial consultation. Education and training is what I do. So I'm at Southern Caregiver Resource Center, have been there for a while, leading our education and outreach program. A lot of our activities that we have are now online, but we've actually started transitioning that a couple of years ago when we realized that the family caregiver was a part of the sandwich generation. They were working at least 20 hours outside the home and also caring for small children and their elderly parents. And so we've started to transition a lot of our programming to an online platform. And what I'm going to do right now is share what we are calling our iCare portal. Our iCare portal is an online list of resources available to anyone in both English and Spanish. And the first one that I'm going to click on here is called our Caregiving Corner, and is 1 minute. If you only have 1 minute to watch one of our videos, then maybe you're doing it while you're waiting for a doctor's appointment. You click there and you can see a list as part of our YouTube channel, and click on any of these topics that are related to caregiving. What is great about that is you can watch them at any time. You can share them with people, and it's really beneficial for someone who, again, has limited time. We also have podcasts, and in podcasts, we talk about those difficult conversations. You know, a lot of times caregivers are afraid to ask that difficult question about, end of life, or the ambiguous loss, caring for someone who might have dementia, and therefore your relationship changes. So we really delve into these very difficult topics, but in a way that is very informal, that you can listen to, again, at your own leisure. We have live stream classes that have, and again, you can click on this and you can see the whole list of our different topics related to caregiving. The one that we just recently did was related to COVID-19. So the way that we are trying to deal with the situation, because as we all know, it's not difficult. I mean, it's not easy. It's very difficult. And being a caregiver is extremely challenging. And now you add this COVID situation, the anxiety, the stress, the unknown, just really adds a different layer to our caregivers. So we put together this bulletin. And this bulletin it's very quick, succinct document that talks about how you can take some precautions as we navigate this pandemic, how to plan ahead. So I know somebody had mentioned prescriptions, doctor's appointments, but we talk about, for example, designating a friend who might serve as an emergency contact should you have to, go to the doctor and if you're feeling sick. Ways to stay healthy, and then of course community resources, and we have here AIS as well as 211, as well as a list of meals for children, because again our caregivers tend to be in that sandwich generation, at least the majority of them, and then stores for the elderly. We have this list or this bulletin in both English and Spanish, and of course we've shared that with your office. So if anyone is interested in obtaining this information, feel free to send us an email or give us a call. What I'm going to do now is I'm going to give you the website, and the website is scrc.care, and our phone number is 858-268-4432. Now, what I want to let you know is we've heard from a lot of our caregivers and people who are starting to connect with us, who sometimes feel that how do they reach out? How do they get assistance? Again, you don't have to do it alone. That's why we are here, and we've been here for a while now. What we want caregivers to know is give us a call. We have live people answering the phones, and caregivers are actually giving us feedback that is very positive. And they're saying, I was lost. I didn't know what to do. I'm really stressed. I called you. I heard a commercial and I called you, and I didn't even realize that you have live people answering the phones, and that comfort, that compassion that our staff has for them is so important. And so we're quickly connecting our clients to our services. Everything we do is free, and we provide it again in English and Spanish. And all you have to do is give us a call to that number or check out our website. But also what's important is that I know caregivers right now are wondering, especially if they don't live with the person that they're caring for. Let's say you're a long distance caregiver, right? Maybe you live in the South Bay, and the person that you are concerned about lives a different area in California. Although we just serve San Diego County, Imperial County, and that's our geographic base, we are part of a statewide system. And the statewide system allows all of us to serve any caregiver in California. So this is also very important for those long distance caregivers, so that they realize that you are not alone, and it doesn't matter if you're not living with that person. We are here to help you. We are here to provide you that assistance and answer any questions. Part of our services is also developing a care plan. How am I going to go about caring for my loved one? If you do need some meal service or transportation or some sort of a medication, how do I go about coordinating all of that? So we have trained staff, our clinical staff, our master's level clinicians, our social workers, who will work hand in hand with our caregivers so that they get connected to the appropriate services. So again, I thank you for the opportunity to talk about our services. Feel free to check out our website, scrc.care, or give us a call, 858-268-4432, and let us know how we can assist you.
Thank you very much, Marta. And I want to encourage all of you, if you can, click on the chat icon there. And if you want to add any web pages or telephone numbers, it would be helpful for anyone to access that information off of our chat line. We're going to move on to our questions and period. We have several questions that we fielded from the public prior to this call, and that also includes several calls that several questions that we've been getting from the various callers calling our offices. I'm going to suggest that maybe one of you answer the question, but if you don't know the answer, we can probably ask somebody else. And if I didn't call you, but you do know the answer, please let me know that you want to also take a stab at answering the question. So this is really open to everybody, but I'm going to suggest that one of you answer the questions. First question, and maybe Carlos Morales or Rosie Blankenship can answer this. How do I get my medications if I'm trying to avoid public interactions? Carlos. And unmute your, I think you're mute there, so.
There we go. Now I'm unmuted. Thank you for letting me answer this question. The first thing that I would do is, and a recommendation that I have for everybody is, in these times, fill your prescriptions as soon as possible. Don't wait. If your prescription, if you need to fill it and you still have like a month's supply, start doing it right away. If in the event that, I guess the question is, well, I want to, I don't want to have a lot of contact. Well, there's a number of ways that you can get your prescription filled without having contact at all. You could, I would suggest you would contact the pharmacy that you usually use, see if they have some kind of delivery service. And perhaps they'll be able, some of the health providers, the insurance carriers also provide mail-in prescription services. So that might be a way to get your prescriptions delivered to your home, but you need to do that way beforehand. Another way perhaps is to check and see if the pharmacy has a drive-in where you can call in your prescription, to get into your car, or get your caregiver or loved one to get into your car, into their cars, and go pick it up. And it can be done directly from the car. There's our contactless pickup services available, where you can ask a service to go pick up your prescription and deliver it as well. And I think the best way, once again, is to go online and check in with a particular pharmacy and see what services they're delivering. I know that a number of pharmacies and providers have been adapting their services so as to be able to deliver medication straight to the individual's home.
Ms. Blankenship, did you want to add to that?
Yes, I would like to add for those in Imperial County, if you visit our website at www.aaa24.org, you can download the list that we have of all the pharmacies in our county that have phone numbers, addresses, and will let you know if they deliver. In addition to that, if you contact our agency at 442-265-7030, we can assist with the delivery as well. Thank you.
Wow, that's fantastic. Wonderful service. Thank you. Our next question is, will coronavirus have an impact on the price of my prescription drugs? Maybe Mr. Bob Pratt.
Well, why, thank you. We have actually studied this, and there's not an expectation now that these drugs will go up more than they have in the past, which is too much. The rising cost of prescription drugs is really a main driver behind the healthcare's affordability problem, especially for us older adults. Our report found that from 2006 to 2017, drugs have gone up, pharmaceuticals have gone up much more than the rate of inflation. And so it's a high priority for us to stop that, and we have a Stop Rx3 campaign. There are probably two things that can be done to stop this pharmaceutical escalation. It is to stop drug companies from using anti-competitive practices like pay for delay, where companies are paid to delay development of equally effective drugs for less costly generics by big brand name companies. Senator, we thank you for helping us to stop that in California. And also another thing that we can do to stop this price escalation is to allow Medicare to bargain for best prices on pharmaceuticals, like the government does with almost any other purchase. So we don't expect an abnormal rise in drug prices.
Thank you. The next question is, as a caregiver for my disabled father, what extra precautions can I take to help protect him? And maybe Marta Rañón, would you like to take a stab at that one?
Absolutely. This is a really good question because we usually talk to caregivers about accessing services and also practicing some self-care. But how do you do that when we're all socially isolated and living together? So the first thing that we would recommend is definitely follow and adhere to the CDC guidelines about washing hands and disinfecting surfaces and coughing into your sleep and all of those things. But also really maintaining a close look at the person that you're caring for, especially if they have a pre-existing condition and or an underlining medical situation where things might rapidly become something more serious. So stay in touch with the doctors and let them know if you notice some changes. Now, in terms of what we would recommend, if barring any emergency situation, is obviously stay home as much as possible. If you are the caregiver living with that individual, designate an emergency contact. And maybe that emergency contact is your neighbor. So, in case you become ill and you are not feeling like you can take care of that individual, that you can count on somebody quickly to come to your house and help you stay with that person or even take that person to the ER or even call 911. The other would be is designate another person to be the person that goes shopping for groceries or picking up prescriptions so that it's not you, the primary caregiver, exposing yourself to the virus or to others out in the community and then maybe inadvertently bringing it home. So designate someone else and you stay home as much as possible with that individual. And then, of course, we have a lot of suggestions on how to stay active mentally, physically with our care receiver so that you also exercise and eat healthy and stimulate the brain as much as possible.
Okay, thank you. Next question is, I just got a call from my electric company saying it will cut off my power if I don't pay my bill within 12 hours. What should I do? Mr. Parelle, if you want to.
Yes, thank you. As I mentioned earlier, any company, whether they're a public utility or a government agency, or even someone posing as a family member, if any of them call you and demand immediate payments, it is 100% a scam. The best thing to do if you get a call from the electric company or the IRS or the Social Security Administration, if you are legitimately concerned that they are calling you, hang up the phone immediately, then look up SDG&E's actual official phone number. Call them directly and say, did someone from SDG&E just call me? Call the IRS if you want to and say, is someone trying to reach me? Call their official phone number. So do not accept any phone numbers or emails or anything that pops up on your computer that is saying that they are some official entity demanding money. And remember, the most important thing, the red flag, is if you are asked to pay for anything with gift cards or electronically or to send money through the mail, you know 100% guaranteed that is a scam.
Thank you. Anyone would like to take a stab at this one as well? What is being done to protect seniors and vulnerable adults who live at home alone? Who is protecting them? Anyone? Rosalina? Ms. Blankenship, you want to try it?
Yes, what seniors should do first is definitely call the Area Agency on Aging in Imperial County or in San Diego. We, through the California Department of Aging, have established a friendship line, but we are also doing wellness checks. So we want to make sure that older adults are reaching out as part of the governor's campaign, making sure to stay home and checking in. Part of that checking in is not only just checking in with your loved ones or friends, but you can also check in with the Area Agency on Aging. We're here to listen, to help, to meet the needs that are necessary, just basic quality of life. And so that number to call is 442-265-7030. We have friendly staff on board ready to help and talk. And so we welcome the calls. please call our agency, and you're not alone. There's somebody here to be with you and help you during this time.
Thank you very much. We have wonderful panelists all doing wonderful work in our community on behalf of seniors and everyone in general. In addition to these agencies, there's been, you mentioned the Friendship Life California. I also want to mention that as well because it's already helped support 1.2 million Californians over the age of 65. That line will be added to our webpage as well. But however, if we're going to also, I'm going to repeat it again. We'll put that online. I also want to again provide the California Department of Aging, which is partnering with the Institute on Aging to support this effort. The hotline, I'll give it now. The hotline for Californians facing loneliness, the Friendship Line California, is 1-888-670-1360. 1-888-670-1360. And I encourage people to check in on that. We've been doing calls from my office, checking in on seniors. Oftentimes, if seniors don't have a friend or family and they live alone, they can get sick, they can need help, and no one would ever know. And sometimes we want to check in on individuals like that. So if you know someone like that during this time, we also encourage you to check in on any friends, distant friends, or anyone that you know that lives alone that we need to check in on them every now and then to make sure that they're safe, make sure they're okay, and make sure they haven't had any kind of sickness that they're suffering through alone. Ladies and gentlemen, I'm sorry, it looks like we're out of time. Thank you so much to everyone on this call for your time and for all the work that you're doing, providing support to our seniors in the community. Thank you for sharing your expertise with us today. Please reach out to my offices for more information if you need any help with state agencies. We're going to post this chat information session on my webpage so you can review it in the future. You can also rewind to get any information that you might have missed. Again, if you want to call my office, please call us. We're there to help. 619-409-7690. In Imperial County, 760-335-3442. Our capital office is 916-651-4040. Thank you very much and have a wonderful day and keep up all the great work, everybody. Thank you very much.